Throughout this pandemic, we continue to learn more about this virus. And now there is some evidence that COVID-19 could actually trigger diabetes in some patients. Dr. Jennifer Ashton joining us now. And Jen, we know people with diabetes are at higher risk of severe reactions to COVID-19, but actually causing diabetes, this is new. Tell us about this research.
It is new, David, and clues are starting to trickle in, a lot of them based on anecdotal clinical reports about patients who recover from COVID-19 and then present with type 1 diabetes. Now, there is some cause and effect that is theorized here. Number one, in the lab, it has been shown that SARS-CoV-2, this strain of coronavirus, can cause damage to what's called beta cells in the pancreas that are responsible for making insulin. So there is a biologic explanation for it. And it's not really clear whether it's the infection, the inflammation, a combination of two that's doing damage to the cells in the pancreas. And it's also not clear what the breakdown is between type 1 and type 2 diabetes. But this is being aggressively studied because it's yet another clue about how this virus acts when it infects us.
Wow, just one more thing to worry about. Meanwhile, the CDC said today that the coronavirus pandemic is actually moving into younger populations. Both Dr. Fauci and the director of the CDC raising the alarm, suggesting younger people may not be taking the risk of spread very seriously. What's your take on what's happening here?
Well, I am the mother of a 20-year-old, so anyone who knows the mentality of that age group, although to be clear, my kids have been following my medical orders on this. This age group is really raised in a society of me, myself, and I. They think they're invincible at their developmental stage. So it's not a surprise that they think, I'll be okay. This doesn't really affect me personally. So not only can they be a major driver and route of transmission, but they can become infected. And the silver lining, if you will, is that they don't appear to be becoming severely ill or requiring hospitalization in as high numbers as we see with older people. But this is a major issue, and we're not going to be able to control the spread of this virus without everyone buying into doing their part.